Welcome to Fostering Parenthood. This is a space to hear from other foster parents firsthand about how to support your foster youth with their healthy sexual development. I'm Dorothy Daniels, and I've been a mom and a foster mom for over 42 years. Hi, Dorit. Thank you for joining us today.
Hi, Dorothy. It's so nice to be here.
Before we get started, I wanted to make sure we give our listeners a trigger warning because this episode we will be discussing different forms of trauma, including sexual trauma, and how to care for foster youth who have experienced that trauma. We have Dr. Dorit Saberi, and we will be discussing together valuable tools that can be used when parenting children and youth who have experienced trauma. Dr. Saberi is a supervising psychologist and co-founder and clinical director of the Safe Harbor Trauma Recovery Center at Harbor UCLA Medical Center. She is also an associate professor in the Department of Psychiatry at the University of California, Los Angeles, UCLA. Just happened to be an alumni of UCLA, so go Bruins. David Geffen, a School of Medicine and an investigator at the Lundquist Institute, Harbor UCLA Medical Center. Most importantly, she is also a resource parent in Los Angeles County and an adoptive parent of a beautiful, intelligent, bright, and just filled with joy 6-year-old baby girl. She conducts research, provides direct services, supervision, teaching, and consultations in evidence-based practices adapted for diverse populations. Dr. Saberi is an author of several grants, educational curricula, and best practice parameters related to the development and implementation of trauma-informed, trauma-specific care. She also serves, and I'm thrilled to say this, as a vice chair on the board of directors of Fostering Unity. Dorit, I'm exhausted just from talking about all of those wonderful things that you do. How do you do it all?
Thank you for that introduction. And my ray of sunshine in my life is that little girl you spoke of. And I loved your introduction of her even more than mine. So yeah, the way that I've learned to do work and trauma works particularly is not to compartmentalize. To live a whole life and think of holistically, where do I heal and how do I come home from work after a very busy day filled with stories of trauma and really find the opposite side of that, like going to a playground and hearing children laugh and play. That's the way I digest my vicariously traumatic experiences of the day rather than leaving it at work. Yes.
I find as a caregiver, I don't know, their trauma is so significant and it raises its kind of, head in so many different ways. And I find myself, in my case, I have 6 children in my home. And every one of them demonstrates trauma in an entirely different way. Or one of them will spread feces all over the wall. The next one is hitting and screaming. The next one is very sweet and clingy and needy. I have a hard time sometimes just being mindful, right? Just taking all of that trauma and finding a place for it so that I could meet each one of their needs.
Yeah, that makes a lot of sense. And each child demonstrates and manifests trauma symptoms and trauma indicators in such vastly different ways. I tend to think about it as looking at how they manifested in their bodies in terms of physical responses to stress, and chronic illness could be another example of that. How their brains are affected, their thinking, learning, concentrating, memory, switching through tasks and flexibility. I call it cognitive flexibility. The emotions, how they're feeling about themselves, about their others, about the world around them, how much safety they perceive, and how much trauma responses and trauma triggers they're responding to with hyperarousal and with the fight, flight, freeze, fawn response as well. And then the behavior, how much impulse control or fighting, or then leading to more problems later on, like substance abuse or non-suicidal self-injury, cutting, harming. So I think of those four aspects, and each child is different, but we can think of different children based on their age manifested differently. And we think of 0 to 5, 6 to 12, and 13 to 18 as having distinctly different ways of manifesting trauma. So from the younger children, more irritability and fussiness, maybe a startle response. We call it like the hyperarousal response from trauma. The clinginess, you mentioned that. The delays in reaching milestones, that's maybe the 0 to 6 or 0 to 5. And from 6 on, the attention, the more oppositional stances, the resisting maybe potentially, and then the somatic experiencing of the trauma, like headaches, stomach aches. And then the older ones either talking about trauma or refusal to talk about trauma, feeling tired, their depression, the neurovegetative states of anhedonia, depression, sleeping too much, sleeping too little, eating too much, eating too little. Then running away, other impulse control behaviors. So really it depends on the age. And then, of course, how much support and how much stable caregiving is in their lives to mediate and mitigate those symptoms.
Which is not an easy task, right? I mean, if we're
Not at all. Not at all.
many of our caregivers suffer from secondary trauma, right? Because we work with these kiddos every single day. They're having behaviors based on their trauma many times. And I don't know if you see this, so I'm sure you do, but they're given so many different diagnoses. And oftentimes trauma goes without a lot of, digging into, right? Like, oh, it's oppositional defiant disorder. And we have these, lists that they give our children. I have a kiddo in my home that has probably 10 diagnoses, none of which is trauma. And so even though we all know he suffered trauma, how many kiddos do you think in foster youth experience trauma?
Yeah, that's a great question. I think we can compare it to non-foster youth. So the statistics I have here is about 5 million children each year in the US experience some type of traumatic experience. And nationwide community studies estimate between 25 to 61% of children and adolescents have a history of one exposure to a potentially traumatic event. So that's the general population. But the work of Stein really is a staggering statistic of 90%. So his studies, 90% of children in foster care have experienced a traumatic event, with nearly half reporting exposure to 4 or more types of traumatic events. And when we think of traumatic events, just to classify what we mean for a minute, I think of the 3 E's. So an event that's occurred, and the experiencing of that event, and the effect of that event, right? And so thinking about that, and thinking about the most famous 95 to 97 A study that looked at over 17,000 participants, classified those events in 3 categories. So abuse, which is physical, emotional, or sexual; neglect, which is physical and emotional; and household dysfunction. And there are 5 items in that category, which is mental illness, incarceration of a relative, domestic violence, substance abuse, and divorce. So they took that study from 95 to 97, and they looked at the tipping point being 4 ACEs, for adverse childhood events. And they noticed chronic obstructive pulmonary disease, smoking, suicide attempt, alcoholism, vastly greater risk for chronic obstructive pulmonary disease, for example. It's 390% greater risk when you have 4 or more ACEs. So they took that study, which was conducted in San Diego, and they expanded it. It's called the Expanded ACE study, and they did it in Philadelphia with inner city youth. And they noticed that the percentages are even more extreme, going from 70% reporting one ACE, one adverse childhood events in the original study, to almost 84% reporting an ACE, and then many more, double the number of 4 or more in inner city youth. And what they added for the risk factors is living in foster care, bullying, community violence, community lack of safety, and then structural discrimination, oppression, racism as the other. You could see in my slide right now that's showing that you could see the expanded study adding those important other factors as well.
Wow. Wow. I know I have seen online a place that you can go and actually kind of take that ACEs test.
Yes.
So, would that be helpful for caregivers to do, not only for the kiddos in their home, but also for themselves? Because many caregivers, I'm one of them, have a relatively high ACEs score just because of my own history. Is that helpful to
Yes.
understand?
I think it's very helpful. I did mine again today just to remind myself, and I had 3 as well. So here's a little personal information about me. I think it's why I do trauma work is that coming from the background of refugees and coming to this country and being here and experiencing some of that, the structural oppression, discrimination, trying to fit in, not fitting in, and absolutely, it's helpful to know yourself first as a caregiver and know what you're bringing in and your own stress response and where you hold it in your own body, and bring in the mindfulness practice to, as you parent, how to find the compassionate parenting, which really helps a lot. And so, if we think of trauma informed parenting, trauma informed care, and then transcending even to what community resiliency model talks about, which is resiliency informed care. It's almost the
Mm,
next evolution of trauma informed.
okay.
Trauma informed asks, what happened to you, which is better than what's wrong with you. Resilience informed asks, what is strong about you that can help you
Oh.
heal,
Oh, you're gonna make
which
me
I love.
cry.
So,
That's so powerful.
yeah,
That's so powerful because what is the first thing we do when we have a child come into our home is we say, What have they gone through? What's wrong?"
right,
Right? What are the
right, right.
behaviors? And instead of looking at strength-based first, and also the same for us. We need to
Right.
look at our strengths and what we can bring, in that healing, element for the kiddos. So important.
Absolutely.
I remember
Yes.
when I Oh, go ahead. Go ahead,
I
please.
wanted to just tell a quick story that maybe
Please.
demonstrates a little bit of that and the trauma informed. So, trauma informed essentially is a more holistic approach to thinking about the context for healing, the impact of the trauma,
Mm,
what is the new knowledge, and how do we not re-traumatize, and how do we attune and attend to those triggers and really work from strengths and allow the beginning safety to begin, trustworthiness with the care provider, having an empowerment and a voice, and then even noticing your own stimulus value and how that could be potentially triggering, even if your words are mild and invitational and mindful. Just your stimulus value, how you look, your size can be triggering to a young child or to anyone really. So the response may not be what you're doing, and the only way to counteract that is just be vulnerable with the child and speak about that. I'm noticing you're reacting to the fact that I have curly hair. What does that remind you of? What comes up for you when you think about that? And so we think about strength based often is we think about what were their pre morbid before the trauma wonderful aspects of life and assets. And so I had a child that was loved to sing and had a beautiful voice. And part of the abuse was physical and damaged her vocal cords. So she couldn't sing anymore. And she transcended from that trauma to being a speaker. So, a new way she found to use her voice is to be a speaker for a human trafficking organization. And now her voice is not used in singing, but it's used in speaking, which gives her a new sense of empowerment and meaning as well. So, the meaning making from the trauma is that resiliency.
And one of the things I think that we're challenged with, but also I think it's very exciting, is as caregivers, we need to find out what is that special gift that that child has. And so instead of focusing on the child's negative behaviors, really looking for those areas, those little nuggets that we can grow. Um, Sometimes that can be really
Absolutely.
challenging, right? It can be really challenging.
Very, very. And you're right. You mentioned that this maybe the diagnosis is oppositional defiant or conduct disorder. What I'm noticing when we get referrals from the school system, that often the diagnosis of ODD is actually trauma. We have one example of a child who came in with that diagnosis from the school system. And we just scratched the surface and noticed that there was quite a bit of bullying. And in the expanded ACEs study, bullying is one of those factors that weren't taken into account before and now is. It was so drastic that he ended up needing intensive medical care. So it's not just mild bullying that's verbal, it was a physical bullying episode. And it was a trauma response that caused how he showed up after that, mistrusting and suspicious, and essentially what they called oppositional was just his own body reacting to the felt sense of lack of safety and danger and
Wow.
perceiving it everywhere. And so, working
Mm.
from a trauma informed care means that you go into a system and try to change it too. Go into the school system and say, wait a minute, this is not a fitting diagnosis. This is what you're missing here. Here is how we see him. This is the kind of help that he deserves and that can help him heal. And so, kind of thinking of a macro level interventions, both in terms
Mhm.
of policies about multi generational trauma and how to intervene for all, how to create less stressed environment for families, how to use advocacy group, grassroots organization. All that is part of trauma informed care is like primary prevention and macro level interventions.
That macro level can be challenging at times. I know just myself, my granddaughter was adopted and she's
Mm,
5. And she really, from birth, was taken and put in a beautiful home, but her prenatal experience, the substance abuse, the
right.
exposure, right, the trauma
Hmm.
from the womb, actually caused her to have trauma. And even in kindergarten, she has been suspended
Mm,
because of behaviors that she literally cannot control. And when you go
right.
on that macro level and you try to inform them, this is not a naughty girl, this is a trauma response from what she's been through in her little life, a lot of
Hmm.
folks look at you like, oh, okay, sure. Right? They just don't
Hmm.
understand what you're trying to say. Is there something that we can help to educate that macro level so that we don't feel like we're the only ones fighting?
Yeah, that's a great question. I think certainly a lot of policy changes are needed. So,
Mm,
thinking about that, it's even greater than just the school system, but macro all the way
mm,
to new legislature, new laws,
yeah.
new funding programs. I love that there are programs that are now developing that are one stop approach. They call
Mhm.
it Child Advocacy Center. I used to work in one when I was doing my PhD, where when there's abuse that everyone is in one setting: the attorneys, the law enforcement,
Mm-hmm.
DCFS, the mental health practitioners, the medical providers. They're all gathering in one setting, so the child doesn't have to go between one setting to the next, to the next, to the next. And what that creates is a lot of safety and a lot of collaboration and a lot of not having to repeat the story and re traumatizing. So, having more centers like that would be an example of uh, policy that actually enhances services for children that are traumatized. There's only two that I'm aware of that they have. It's part of Child Help USA that has that one-stop shop, but hopefully more
Wow.
money can be used to create that.
And sometimes we just
But
have
I
to
think
ask, right? We just have to show
right,
up at the
right,
IEP and say, hey, guys, we need to do better. What can we do at my
right.
school? So,
Absolutely.
yeah.
Absolutely. And yeah, and then in terms of the caregiver, and I'll use a quick story with my little
Mhm.
girl. I think it's listening, reflecting, attuning, staying curious, and not jumping to inferences or assumptions. And I shared the story with you, and you said you really love it. She created this beautiful jar for me for Mother's
Mm.
Day, and hand painted it. It was beautiful, and she was very proud of it, and she wanted to show the neighborhood, and then she left it at the stairs after showing it around, and a neighbor who came by accidentally bumped it and it broke,
Mm.
and she was so dysregulated emotionally, just crying, sobbing. And I knew that the jar meant a lot to her, right? But it doesn't necessarily stop there. So initially I said, let's replace it. We'll hand create another jar. We'll paint it together. She was still like heaving, crying. And then I finally just got curious with her, and I sat down with her next to her and I said, what was important about that jar, honey? How did it mean so much to you? What was important about it? And she said, it wasn't just the jar, Mama. I put some roly polies for you in there, and when they got knocked over, I think they got squashed. And so it was much bigger than the jar. So I always use that as the moral of the story. It's not always just the jar, right? And so I think to myself, what else can I ask that will invite their own experience, that I'm not going to assume, that's going to allow them to speak and have their feelings counted and their feelings emoted? And how do I honor providing that space for them? And that's been the quest ever since that episode is, and I knew it from working with clients, is how do you stay curious? How do you find the validation that goes deeper? And that's
Mm.
what's needed for trauma, for
Because
all kids, but especially ones who are traumatized. Yeah.
there's a reason, right? I always tell my children that behavior is an overflowing of the heart, right? There's just
Mm.
so much emotion that the behavior is because the heart can't hold it all. And it just literally overflows into behavior. And it's really
Mm.
important for us to help unpack it, right? To help figure out where the roly polies are. And I,
Yes.
I
Yes.
know I had shared with you a story. I remember when I first became a caregiver, I had folks say, well, you need to laugh and you need to be joyful and you need to be lighter and curious and find the positive and the strengths. And then when the very first child cussed me out and then spread feces all over my wall, I had a really hard time finding the joy in that, right? Finding the roly
Mm.
poly, because to me, I mean,
Yes.
it wasn't a really pleasant experience. But I will tell you, now that I've done this for quite a few years, it makes so much sense, because when you're dealing with the feces on the wall, that that is just the outside flag that's waving to say, I have something so much deeper to share with you.
Mm. Yes.
And when I have a little one, she's 12, but developmentally she's about 6. And she was playing on her iPad, which normally we are very, conscientious about any kiddo on social media or just anything.
Mhm.
And she was caught watching pornography. Well, my
Mm.
first reaction would have been, oh my gosh, you're watching pornography. That's, terrible. Why would you do that? But now, as I look with the roly poly mind, I truly look at it in a different way. And I say, she's not watching pornography because of behavior. This is bringing up something far deeper for a child who experienced horrific sexual abuse. So
Mhm.
I just said, boy, I can see that you're trying to find something. What is it that you're looking for? And she really couldn't answer, but I didn't feel it was necessary to do anything punitive, right? This
Mhm.
wasn't a behavior
Correct.
that needed discipline. How would you have handled that, Dr. Saberi? I mean, because our kiddos, they do things sometimes that just doesn't make sense to us.
Right, right. The key with validation is to find the kernel of truth and validate
Mm,
that, but not validate what's not valid. So I come back
okay.
to that often. And when I think about how do I respond, I first start with curiosity. What happened? Why this particular decision to engage in watching this? What is she curious about? What led her there? Maybe she's trying to figure out what happened to her,
Mhm,
right? And so staying curious and asking open-ended questions and purposely not being judgmental and not being punitive. So starting there and saying, what are you trying to figure out? Is there something you and I can talk about without watching this? And then explaining a little bit, this is not
mhm,
the slice of humanity that most people engage in. This is sort of a sensationalized depiction of human interaction that includes affection and care and love, but it's just one angle of it. Of course, I would use simpler words for a 6-year old developmentally, but I would use some essence of that she can understand. And then I would invite a conversation about maybe what she's craving. Is there more need for affection and connection? And maybe physical touch has always been something that she abhorred. And maybe she's now wanting it, wanting more of it in a way that feels safe to her. And maybe that's where she's gravitating to people kissing or people touching,
mm,
albeit not a very great depiction of it through pornography. So, talking to her about expression of affection and love and what that means when it's done in a way that promotes actual healing and human connection. And then I think it's fair to set a boundary. So the validation and not validating what's not valid, that you still want some restriction of it. So maybe speaking about this is not what we watch at home and this is not
mhm,
allowed, and having a boundary around it rather than thinking punitively or
mhm,
even in terms of contingency, like you did this
mhm,
and therefore your rights are going to be, or privileges are going to be removed, but more this is a boundary. And when you have curiosity about that, I'm here to speak about
mhm.
it. Yeah.
Wow, that's a lot to think about. And I know sometimes, again, it's difficult to be in the moment. You're frustrated, or you're just not seeing
Right.
that kernel of truth. You're not seeing why the jar broke or what was inside it. You're
Hmm.
just having a really hard time. Do you have just a tool for caregivers to help them kind of be in the moment so that they don't lose that, that calmness? Because we all know that we can't help a child regulate if we're dysregulated, right? So how can someone
Absolutely.
do that?
Yeah, that's a great question. There's so many ways, but I will choose the most simple way that I've learned in all my years of both being a care provider for my nieces and nephews out of necessity, and now being officially a resource parent, an adoptive parent. And I go back to mindfulness, which is my practice. I'm a practitioner of dialectical behavior therapy. It's a core element in that treatment. I've been using mindfulness for about 30 years, since I was at least 5. And to to me, it's not this sort of sitting in lotus position and breathing. It could be part of it, but it's to me it's 3 elements: is non-judgmental stance, just being in the moment and receiving and attuning to what's around you without judgment, not running to past or future, being grounded and anchoring yourself in here and now, um, and essentially being attuned to everything around you, like whatever experience you're in, whether it's listening to your child scream, that you're almost an observer of that. You're not personally necessarily affected by it, but you are an observer of that experience. And there are 3 basic skills of the what to do and 3 basic skills of how you do it. So observe, describe, participate. Just give them, look at what's happening, give them words that are not judgmental. They're using a loud volume, they're screaming, they're smearing some feces on the wall without my walls and horrible smell and whatever else you can add to that description. And then the non judgmentally, one mindfully, effectively. And so here's where I can maybe share a story, which isn't about a child, but it's about an adult that lived with a rather regimented father who was a Marine and kind of led the household very strictly. And this child grew up to be a certain law enforcement provider. I'll leave the organization away, and notice that he's just not getting along. There's excessive force complaints about him. Um, his family life is not thriving, and he confesses to that, and he wants to promote, and he's told he has to go to therapy. So he comes to me saying, "There's nothing I can learn from you. I don't know why I'm here. I just want to promote, but nothing is wrong with my life. It's all them." And we have 5 sessions, we're told. And I say, let's just do mindfulness. That's all we're going to do. And he tells me, I knew you were kind of crazy and out there. And I received that without judgment and proceeded and taught him pretty much the skills I just spoke about: observe, describe, participate, non judgmentally, one mindfully, effectively. He goes out into the world and I tell him, just use those skills and attune to others, people you interact with, your subordinates who are complaining about you, your family, your children. Just notice what they're doing and see how you can remove judgment and not react. Respond, but not react. So nothing happens. 1 session, 2 sessions, 3 sessions go by. Nothing happens. The 4th
Oh,
session, he
no.
comes in and he says, I'm a changed man. And I say, okay, tell me what happened. And he says, I was in line at the store and this older woman with a baby rushed in front of me. And I was about to yell at her to get out of my way because I'm late for work. And it was my turn. She cut in. But I do my observe, describe, because I figure I only have 1 more session to put up with you. So I did it. And I noticed she's older and the child is like about 2 and she's kind of cute. She has like brown curly hair and her hair is in pigtails. And I noticed that. And the woman comes to the cashier and they start talking. And now I'm upset again. So I'm about to go over and yell now. And I remember 1 more time just to take a breath and observe. And finally, it's my turn. They walk away. Well, at the very end, like she hands her the baby, the cashier, and the cashier is sort of holding the baby. It was like about 2, and maybe cuddling and talking to her. And I'm like curious what's going on here. Why are they wasting my time? And they finally leave. And I walk up to the cashier and I say, that was a cute baby. And she says to
Wow.
me, she says, I'm glad you think so, because that was my daughter.
Oh.
And he's interested now more. And he says, oh, yeah, what was that about? And she says, well, my mom brings her. I have 3 jobs. My mom brings her at breaks, but this time she brought her and I was still working. And I didn't want to miss the opportunity to connect with her because I don't really get that much time anymore to connect with her having 3 jobs. And he said, 3 jobs is a lot. And she said, I don't have a choice. My husband was killed in a lost deployment. So this is the only opportunity that I have to connect with her. And I will take it if that's all I get. And he leaves and he notices that something shifts within him. He actually notices tears. And then he walks. And as he's walking, he notices that he's crying. He's actually sobbing. And he realizes that he would have just yelled at this older woman with the baby and would have been completely oblivious to their experience and to their pain, and maybe his own opportunity to connect at a human level that's lost now. And he starts realizing that his life has been full of those lost opportunities, full of those lack of connection, alone, isolated, lonely, and not wanting that life anymore. So he came back and he said, mindfulness saved my life. And it only took 4 sessions, not even 5. And so that's my superpower. And I think that's the superpower that all parents and all people can use in terms of just staying in the moment and connecting with others and taking away the judgment and realizing what pain dwells there.
What pain dwells there?
Mhm.
Why we became foster parents in the first place is
Okay.
to heal children. And our job is to not judge and not to discipline, so to speak. It is to be mindful that they're hurting and what pain dwells there.